Jimothy! What? You're gonna love this one. Please. No.
Okay, this one's really important. Understanding copays.
Much I hate when customers use the health insurance they pay for. Yeah. Well, allow me to introduce you to the copayment. It's a fee that every patient has to pay up front when they get health care. You want to punish people for receiving health care? No, Jimothy. We're encouraging them to be more prudent with their decision to seek health care. It's a punishment. Okay, yes, we're punishing them, but it will also decrease healthcare costs in this country. We're doing something good for society. No, we're not. Excuse me? Nickel and diming people like this will result in patients not seeking any care at all, even if they really need it.
So a copayment is how much you're gonna owe every time you see a doctor. It ranges between $25 up to $100 depending on the insurance plan. Now, copayment for seeing a primary care doctor typically is less than seeing a specialist. Now, I'm a specialist in asthma, allergy, and immunology, and obesity medicine. Well, now let's ignore obesity care because that's typically not covered by insurance. But with asthma, allergy, and immunology care, that usually goes under the copayment as a subspecialist for my patients, which means their copay costs are quite high. Now, a copayment is used to de-incentivize you from seeing the doctor, and a doctor is legally obliged to charge you your copayment if you have insurance. So let me explain how this changes the dynamics of care between me and my patients who tend to have chronic medical conditions that they've been dealing with for years up to decades before they've seen me. Let's say somebody comes in with a $100 copay for every single visit. Now, if they have something like hives, it might take me 3 or 4 visits to figure out why they're having hives, which means that they have to pay $100 every time they need to see me. Now, that's $100 I cannot waive. Now, they will owe the copayment even if they've already met their deductible. The only way they will not pay the copay is if they met their maximum out of pocket, which could be up to $15,000. So often patients will give me one chance to figure out what's going on, the first visit. If I need a follow-up visit, they might not show up because they don't want to pay the $100, which causes a gap in the care or incomplete care. And this is with many conditions. Almost all the conditions I treat are chronic. So somebody dealing with chronic sinusitis, dealing with severe persistent asthma, dealing with food allergies, or dealing with immunological conditions. They start to try to decrease the amount of times that they see me because they don't want to pay a copay every time they see me. Remember, I have to charge the copay. And often I have to do this over several visits because the medications that they need require medical records, which require multiple visits. If you need an advanced medication for asthma, I often have to show them that you've been on medications for over a year and been seeing me multiple times over the course of a year in order to get the medications. Medical conditions like chronic sinusitis, AERD, allergic fungal sinusitis, chronic idiopathic urticaria, severe persistent asthma, atopic dermatitis. Several of these are lifelong conditions, or at least things they're going to have for years unless we treat them or desensitize them. And I develop severe gaps in care because patients have a hard time paying the co-payments and can't come in for the visits. The most common complaint patients have with us are that we're charging them co-payments, and we legally cannot waive them. So this is from the Texas Medical Association explaining essentially how if physicians waive copays for somebody with Medicare, it's considered fraud. And it can be violation of contracts to waive copays for insurances. Again, explaining that copays are not meant for the doctor or the clinic you're going to collect money from you, but they are a fee essentially that your insurance is charging you by making you pay the doctor, making them the collector of this, in order for you to seek out care from that physician. And then they will go after the physician and audit them if they're not collecting the copays. It's important you understand this because copays are one of the best ways that insurances have to put you and your doctor at odds with one another so that you don't seek out care. And while physicians cannot waive copays in the US, they can set up like payment plans or delayed payments for the copays, but they have to show that they attempted to collect. Now, everything I said is general. If somebody has some exception about one doctor waiving a copay here and there, I'm not talking about that. I'm talking about the general legality of it all. All right, hope that helps.